Constipation. Many people suffer from constipation where they strain while on the toilet and have hard or lumpy motions. They may feel like their bowel is blocked and have a bowel motion less than 3 times a week. Constipation can be caused by a lack of fluids or food, stress, poor diet with not enough fiber, and medications. Eating more fibrous foods such as vegetables, especially cabbage, red capsicum, peas, beans, broccoli and corn, fruits including grapes and stone fruit can help. High-fiber cereals and bread, spices, fiber supplements and fruit juice, drinking fluids and exercise can all help some people with constipation. Using a laxative and changing medications may be required to help relieve constipation. Gas and bloating bacteria live in the large bowel to help break down undigested food, and it's this type of bacteria that can cause gas. It's normal to break wind daily, but too much gas may be caused by eating foods that don't agree with your digestive system, such as foods from the cabbage family, dairy, eggs, artificial sweeteners, soft drink and bananas. Some people experience gas due to poor pelvic floor muscles. Disease and conditions affecting the bowel. Stool samples are used to screen for disease and illnesses. A stool culture is used for identifying bacteria or parasites that may be causing diarrhea. The Helicobacter pylori bacteria may indicate a stomach ulcer or stomach cancer. Bowel cancer screening. A fecal occult blood test, FOBT, is used to test people for blood in the feces that may come from polyps or bowel cancer. The test can show up tiny traces of blood that aren't visible to the naked eye. In Australia, most Australians aged between 50 and 74 are eligible for free FOBT tests as part of the National Bowel Cancer Screening Program. Early detection of bowel cancer leads to good survival rates. Blood is detected in 1 in 14 tests, but not all positive tests will have bowel cancer. The blood can be caused by polyps, hemorrhoids, or inflammation. A colonoscopy is a more in-depth look at the bowel to determine the cause of a positive FOBT. Health conditions impacting the bowel. There are a range of conditions that affect the bowel. Some are minor while others have serious health and lifestyle implications. Irritable bowel syndrome, IBS, a common gastrointestinal problem that affects 11% of adults. It may cause abdominal pain, bloating and alternating between constipation and diarrhea. Crohn's disease, an inflammatory bowel disease and autoimmune disorder that affects the colon and part of the small intestine. Ulcerative colitis, an inflammatory bowel disorder that causes inflammation and ulcers in the digestive tract that can cause bleeding and discharge. Celiac disease, an autoimmune disorder where gluten in the diet causes the immune system to attack the inner lining of the small intestines.